Are you ever truly safe? There's been over 1,062,130 deaths from COVID just in the United States. And with every cough and sneeze, these numbers will continue to proliferate. With life seemingly going back to normal, certain precautions can be made to improve the general population's overall health and just simply make navigating this pandemic easier. This past summer, my church decided to open its doors back. As the youth ministry assistant, I'm frequently working with children, and sometimes their parents are too busy or overwhelmed with their needs to realize they have a runny nose or a small cough. But unfortunately, that became our downfall when we had an outbreak in the youth ministry department. Luckily, the students who did not interact with these children and wash their hands did not get COVID 19. As a witness to the miracle of soap and water, I encourage every college student to be cautious of their surroundings and to frequently take precautions to reduce the transmission of any bacteria or disease. Today, I would like to reinforce the most effective methods of reducing the spread of COVID 19 via social distancing, wearing your mask, and washing your hands. Step 1. Being a college student, we're all searching for an adventure. We're all searching for a place of freedom and experience. And we can still have that. It just has to be altered for safety purposes. For example, the most simplest step, washing your hands. Washing your hands regularly with soap and water can help prevent the spread of germs. Via the CDC, hand hygiene is so crucial when it comes to protecting ourselves and others against infectious diseases. Let's watch a clip from the popular podcast Chats and Giggles, which features two young women ages 20 and 22 who share their personal experience with washing their hands on a college campus.
And you know what's crazy? And I think a lot of people do this. Like if I'm in a public restroom and there's people in the stalls, I will even after I pee go to the sink, wash the water, like pretend run the water, pretend I'm washing my hands, get some
out
paper towels, get out.
Or I'll run. I'll run out of the bathroom before the
Yeah.
other person comes out. And
With their fan base being so young, targeting teenagers as young as 16 to young adults, this type of rhetoric is dangerous, moreover harmful to the community. That's why it's important for speakers like me to spread a positive narrative about washing hands and encouraging young individuals to never be too cautious. Step 2. Use a mask. An analysis of respiratory infection and mask effectiveness by the Institute of Health Metrics and Evaluation suggests a reduction by at least 1/3 of mask wearers compared to control groups. We know the virus is transmitted via droplets, sneezing, coughing, touching, so it's important to wear a mask to make sure that the spit and saliva doesn't get into contact with eyes, on your lips, on your mouth, and you ultimately don't end up getting yourself sick. Vinnie Matthew, an executive at Integris Health, even said, "We also know from decades of experience as healthcare providers that masking helps prevent the spread of droplet-based diseases." While news to the public, this has been the standard practice in the hospital setting for many years. The third and final step is to maintain at least 6 feet between people. The reason why people recommend standing 6 feet is because it's intended to prevent the spread of contagious diseases by maintaining a physical distance between people and the number of times they come into close contact with each other. This reduces the spread because you're not able, if COVID is droplet based, you won't be able to spread the disease if you're so close to people with physical contact. At the beginning of this speech, I asked you the very question, are you ever truly safe? And unfortunately, the answer is no. However, we aren't incapable of helping ourselves and becoming cautious to improve our health. In order to be precarious, is to frequently wash your hands, wear your mask, and maintain 6 feet from each other in order to reduce the transmission of COVID-19.